to just be good neighbors to each other, to wait 6 feet apart, to wear your face coverings, wash your hands, and if you're hiking, bring some hand sanitizer with you. And I think if we do all of those things in combination, then we'll be in good shape. I do think that folks need to understand their own personal health risks and take appropriate steps for themselves as they think about what's right for them and their family. But we're all going to have to be in this together to work through this. I do think it's a good measured step forward as we open these parks, but I hope everyone can abide by the guidance that we put out. Thank you.
Next question is from Erica Bryant at WSOC TV, Charlotte.
Yes, my question is about correctional, the status as far as inmate testing, treatment, and providing masks, access to soap and hot water, strict social distancing, and other measures.
Erica, thanks for that important question. So in our correctional facilities, obviously it's been very important to identify anyone who has had symptoms of COVID-19, cough or fever, get them tested, and then understand if they contacts and test those. I know in correctional facilities where they've been finding COVID-19, then folks went about testing the entire that entire jail or entire prison, and so I think that work is important. I know that they have worked with our team in public health to make sure that they're implementing the infection control measures that are needed in terms of cohorting patients, getting to testing, washing hands, social distancing, all of the things that we have been talking about. So I know that work is ongoing, and so there have been, we do post on our website the places where there have been COVID-19 in some of those correctional facilities, and where testing has been done to understand the virus further. Thank you.
Next question is from Julie Havelock with the Carolina Journal.
Hi, thank you so much. I wanted to ask about how the age demographics are influencing your plans for the stay-at-home orders, given that some 86% of the deaths are within those 65 or over. So sort of how are you responding to those demographics, and sort of what are your plans going forward?
Thanks, Julie. I think broke up for a second there. I think your question was, how are we thinking about demographics in terms of our decision making for going forward, and saying that some of the, we see more of the deaths in those that are above 65, and that is exactly right. We know that being of higher risk for severe reaction to COVID-19 has you being either 65 or older, or someone with a chronic disease like diabetes, high blood pressure, asthma, immunosuppression. What we shared earlier in the week were some data about North Carolina in terms of health status. And what we see in adults, that more than half of the adults of North Carolina are either over 65 or have a chronic illness. So we showed data that even our 18 to 25-year-olds, 25% of them have an underlying chronic disease. Could be high blood pressure, could be diabetes. From 25 to 40, again, another third. So this is something where there are risk factors regardless of age. Yes, many of our deaths have been in over 65, but then we see the other deaths are often linked to these chronic diseases. And unfortunately, the way that this virus works, right, is when it spreads through the community, it means that there's more opportunities for those who are over 65 or with those chronic diseases could pick that up. There are some who are still our essential workers, have to go to work every day. We want to be protecting our friends and neighbors. So as we think about these strategies, it really is about a collective. So even if you aren't 65, if you aren't someone with chronic diseases, your actions are protecting your neighbor, your friend. I bet we all could think of someone who we know that might have high blood pressure or diabetes, or asthma, or fighting off cancer, or what have you. I think we all know someone like that in our world. And every time you follow the 3 Ws, wear your face covering, you wash your hands, you wait 6 feet apart, you're a hero and you're helping those folks in your lives just to make sure there's less virus around. Because if there's less virus around, it's going to be less likely that those folks are going to catch it. So it is truly about our actions on the many that do impact so much of our folks who are higher at risk. So that's why we really need everyone's help here, not just thinking about those who are at higher risk. So we keep the virus spread low for everyone, and it protects those at higher risk. Thanks for that, Julie.
Next question is from Holden Kurlicki with CBS 17.
Dr. Cohen, April 27th, you announced that DHHS was partnering with Community Care of North Carolina and the North Carolina Area Health Education Centers to form the Carolina Community Collaborative, and that 250 workers will be hired for contact tracing. Who's responsible for paying those employees, and how are those companies selected? And I may have a follow-up question.
So in terms of let me start with who pays that. So that is funding from the Department of Health and Human Services. There was money both from, we haven't decided is that money that is going to be used from the CDC, or is that the CARES Act money that was just distributed by the General Assembly. But that is how those folks will get paid, through a contract with those organizations. The way this organization was selected was through an evaluation committee looked at a submission, their of their proposal of what they would do for the state of North Carolina. I believe we compared at least two different organizations that were able to serve all of North Carolina. We had a number of organizations that said, oh, we can serve the West, we can serve the East, we can serve Central. We were really looking for a partner that submitted a proposal that could serve the full of the state. We asked for them to have experience working with our local health department as well as our data systems, because we needed to get going so quickly. We had an evaluation committee that was formed that was under the person who runs procurement for the Department of Health and Human Services, Iris Cooper. That evaluation committee evaluated the candidates, on the criteria, selected that, and that's how we came up with the final partner, Community Care of North Carolina.
I spoke with a senator today who said he would be calling for an ethics investigation after it was revealed that Community Care of North Carolina is State Health Director Elizabeth Tilton's former employer, and Area Health Education Centers list her husband as their director. Would DHHS support?
Yes, I welcome. Dr. Tilson is obviously an incredibly important member of our team, but she was very aware that she did not want to have any violations of ethics here. So she was definitely not part of the selection committee nor the evaluation process here. So we welcome answering any questions about that going forward.
Next question is from Ken Smith with WRAL-TV.
Dr. Cohen, thanks for taking my call. Ken Smith at WRAL. How important is information from antibody testing, and will the state collect and release that information on positive results from local health departments? Also, why does the state mandate reporting of negative results so we can see a percentage of people who actually show antibodies?
Thanks, Ken. I don't know if I caught the second half, but let me start with antibody testing. Do you want to repeat the second half? It was something about negative reporting, but I didn't catch all of that.
Yeah, why doesn't state mandate reporting of negative results so we can see a percentage of people who actually show antibodies?
So let me start with antibody testing overall, because antibody testing is not as simple as positive or negative. There's a scale of how someone reacts and how much antibody that they have. So again, antibody testing is one that you do. It's a blood test that you go back and look, was someone exposed to COVID-19 in the past? And there are different kinds of antibodies. There's short-term antibodies and long-term antibodies. And so doing the test for antibodies is also a timing issue. You want to make sure you get it right so that you actually can catch the right amount of circulating antibodies in the body. I will also say that we're learning a lot about how to interpret and then how to use antibody tests to understand exposure and prevalence here in North Carolina, and what does it exactly mean? I think we also don't know how long do these antibodies last. I think we know it confers immunity for some period of time, but since COVID-19 is so new, we really don't know what does it look like 6 months from now, since we just are having our first cases in the last couple months. So there's a lot to learn still about antibodies. So that's why I think we are still evolving our thinking on how are we going to use this? Who are we going to recommend it to? And then how do we think about reporting and all of that interpretation? It's not quite as clear as the diagnostic test, which tells you, do I have COVID-19 right now? That's the nasal or nasopharyngeal swab test that we that we do, that tells you, do you have live virus right now in your body of COVID-19? That's a little bit more clear, but even those tests have false negatives. If maybe you don't pick up enough virus on the swab that you're using, you could get a negative result when you're actually positive. You know, depending, we're trying to make sure that we're getting the highest quality tests we possibly can. So what I would say on antibodies overall is still a lot to learn, clearly going to be important, but I think there's a lot of science to be done. And I think we're doing that science, not just here in North Carolina, but really around the country and around the world, to understand what are the best antibody tests, number one, how should they be used, what does that mean in terms of conferring immunity and for how long a period of time. So stay tuned with us as we learn more about antibody testing overall. Thanks.
Our final question today will be from Andrea Blanford at ABC 11.
Hi, Dr. Cohen. It's Andrea Blanford with ABC 11. Can you clarify what is happening with parks and swimming pools in phase 1? For parks, the executive order states that reopening is only encouraged with a ban still on the playground. So we're seeing our state parks beginning to roll out reopening plans for the weekend, but they differ depending on which park you're visiting. Others, like city parks, they have different timelines for when they'll reopen facilities like bathrooms. So there's just like a lack of consistency there. And we've heard you and the governor say that confusion around what's allowable and open and what's not is dangerous right now. So what should all of our parks be doing in phase 1? And then for pools, are they opening in phase 1? Is there a difference for neighborhood pools versus public pools on things like capacity limits, social distancing requirements? Thanks.
Thanks, Andrea, for that. Let me start with parks and then I'll move to pools. So what we are doing is encouraging parks to open starting Friday. They're not required to open. We're encouraging them to open. Again, we're trying to give permission to reopen activities that are lower risk. And we know walking through a park, enjoying the outdoors, getting some exercise, that's a lower risk activity. Now, there are some things within the park that we know continue to be higher risk, like the playgrounds. And so we have talked to a number of folks in the parks space that talked about, we're going to open the parks, but we'll still keep the children's playground closed. So we would like to see that playgrounds remain closed, but the parks themselves generally open. As far as swimming areas and pools, those are to remain closed for phase 1. And really that is more to do with what happens sort of around the pool. As we know, when we all go to pools, we often then sit around by the pools, and it's a slightly higher risk activity. That's something we're contemplating for and are planning for phase 2. But we were saying to have those pools to stay closed for phase 1. So pools can open for phase 2, parks open for phase 1. And again, when we are saying they can open, that is our recommendation. They are allowed to open. Parks are going to have to work on bringing their workers back, their restrooms, getting their facilities ready. So, it doesn't mean they have to open this Saturday. So I would encourage folks to, call or check out websites to see exactly park are open. And then I'll leave, because I know this is our last question, just leave with a reminder is that we all just have to use our good judgment here as we go forward. This is going to be a constant theme as we go forward, is about using our judgment and protecting ourselves and our community, making sure that you bring a face covering with you, make sure that you're bringing hand sanitizer with you when you go to the parks, just in case a bathroom isn't open and you're not able to wash your hands. And of course, going to continue to want to keep saying over and over, and I really appreciate the press corps and others sharing those important messages to protect all of us as we go through this together. I think it's a good step forward for us to ease these restrictions, go forward with some of these lower risk activities. We need to do it carefully so we protect each other, and hopefully so that we can go forward into phase 2. All right, thank you so much for the time. Great to be with you. Have a good afternoon.
Meet the world's first apple cider vinegar gummy, the Goalie Gummy. Apple cider